Well, formal approval tonight for Moderna's two-dose series of COVID-19 vaccine. The decision really having little practical effect, though, when you consider millions of Americans have already gotten Moderna. But tonight we are learning many of those Americans and others who perhaps got other vaccine brands, they're eligible for a booster shot and they still haven't gotten one. Take a look at this statistic here. It comes from the CDC, showing a little more than half of folks who could have that added protection of a booster still haven't gotten it. So tonight we're answering your top questions about the COVID-19 booster, making sure you're informed to make the best decision for you and your family.
And we encourage boosters for all eligible populations.
Doctors and medical experts across the Carolinas continue to urge everyone who's eligible to get boosted against COVID-19. So here are the three things to know tonight on that front. What is the eligibility? What's the difference between the first shot and the booster? And can you mix and match brands? So first, let's talk when you're eligible for this second shot. Well, it depends on which vaccine you got. For Pfizer and Moderna, you need to wait 5 months after your first COVID-19 vaccination series. If you got Johnson & Johnson, you wait 2 months after your first shot. Second, what's the difference between the booster and the first series? Well, it's really not much. The dosage is the same, except for Moderna, which is a half-dose booster. The formulas are the same. They have not been changed to target a specific variant. Now let's talk about mixing and matching brands. The CDC says you can mix and match Moderna and Pfizer's vaccine when it is time for your booster. Now, if your first vaccine was Johnson & Johnson, it's recommended that you get Pfizer or Moderna as a booster in most situations. And medical experts say folks should not pass up on these extra shots.
Recent data suggesting that boosters provide significantly higher protection against hospitalization and death for those most at risk.
And now here is an important dosing development to mention. During a CDC panel meeting today, members revised guidance for a second booster dose for those who are immunocompromised. So current guidance was 5 months after the third dose. The CDC panel, though, in favor of shortening that window to 3 months.